Hey, can you hear me?
I can.
All right, I can hear you well too. Yeah, I was instructed to wear these, so. Yeah.
I could grab some, I guess, but
No,
I don't need 'em.
I don't think there's any need. I mean, if you really want to, you can. But all right, today I'm speaking with Dr. Karla Austin. She's a licensed psychologist who specializes in marriage and family, sleep disorders, and ADHD. I'm really looking forward to chatting with her today about the important relationship between mental health and sleep. Dr. Austin, thank you for being here.
Happy to be here.
Now, I know you've been treating patients for over 35 years in your private practice, but you've also lectured on things like brain chemistry and addiction issues, and you've spent some time in prison. Tell us more about
I
that.
was working there.
Uh, okay.
Yes, but I got to conduct groups with a lot of the inmates, and I helped them with sleep and with their relationships and addictions and things like that.
Yeah, so I guess you have sleep problems in jail. I never thought about
Lots,
that.
lots.
Yeah, I guess I never really considered that,
Oh,
but
yeah.
that's a little bit frightening to think about.
My son even worked with the homeless shelter, and he got them all earplugs because
Oh,
they
do a lot of homeless snore? Is
they
that?
had trouble sleeping in those like crowded
Oh,
places.
okay, I got it. That makes sense. Well, and we can get back to the you being in prison later if we want
Yeah,
to, but
yeah, yeah.
we know that sleep and mental health are intrinsically connected, and you've known this for years. We've all known it. I mean, in many ways, it's bidirectional. We're always learning more about it, but in what ways do you most frequently see sleep entering the equation with your patients? I know that very often they come in and a large problem is sleep. So, and they probably seek you out before they may even seek out a sleep specialist of any kind.
Yes. Sometimes one of their main complaints is sleep, but more often it's going to be anxiety or depression or mood, bipolar disorder or mood disorder or a relationship problem or an addiction or any number of things, problems at work, can't focus, ADHD, it goes on and on and on. But what I know is that if you're not getting a good quality sleep on a regular basis, that increases the likelihood of you having every kind of mental health disorder as well as every kind of physical disorder. So it comes quickly into the equation of what we talk about because it matters. So a lady I talked to earlier today, she's averaging between 4.5 and 7 hours of sleep, and she's diagnosed with a bipolar disorder. So no one has put her on a mood stabilizer, and we've got to take care of her mental disorder. But no matter what we do for that, if we don't fix her sleep, there's a problem. And so right now, I've got to figure out how much of that sleep disorder is because of some mania that may be going on, or how much of that sleep disorder may be otherwise involved, may have to do with apnea, may have to do with something else. So early on, I have to answer a few questions with someone like that.
Well, okay, so you mentioned addictions. So I'll admit, I'm not good at reading people and saying, you look like you're addicted to something. And I think a lot of times they won't say that on their health history.
No.
I think probably patients guard that information pretty closely.
Yeah.
So, are there any telltale signs that we could see in our patients that might let us in on an addiction of some kind?
Well, I
What's the
mean,
most
you
common?
might recognize a more extreme drug addiction because you may see bloodshot eyes and shaking bodies and other symptoms that make that clear. But um, a lot of addictions aren't going to show on the outside. It might be a pornography addiction, and that may just lead to bad habits. Maybe they wait till the spouse is asleep and then they stay up involved in their porn, and so they're not getting enough sleep. And so now they're irritable, they're edgy, they're, well, what do you blame the porn? Do you blame the lack of sleep? Is it both?
Yeah.
So sometimes it's that kind of thing. Sometimes they're mainlining caffeine. And even that's the thing that you're not always going to know. And or they don't realize. I know somebody recently, she was off of caffeine, but then she goes, "Oh, it's my energy drinks." And so she was drinking a pre-workout before she worked out.
Yeah.
Only she was doing this a lot and she was really into her pre-workout.
Yeah.
And so it was this caffeine that was going. So it might be that there's something like the caffeine thing going. It may be alcohol. People have been led to believe that alcohol helps them sleep. So and alcohol is one of the worst things for sleep. So if it's too close to bed. So a lot of times it's breaking those habits, helping them understand what works and what doesn't. Sometimes it's marijuana, and that's certainly something that they're not going to tell everyone, but that along with alcohol, they make the top two in the worst things for your sleep.
Well, we ask that question on our health history. We say, what do you drink alcoholic beverage? And then, on our specific one, it asks if they drink spirits or wine. And I would say 90% of the time they say in the affirmative that they do one or the other. I do believe that they underreport how much they drink.
Yes.
Because when we also ask how often or how much do you drink.
And when.
Yeah.
And the when.
Well, yeah. So do you have success if somebody does have some insomnia, for example, or they wake up at 3 o'clock every morning and you notice and you know that they're drinking alcohol right before sleep to get to sleep, but then they wake up halfway through the night? Do you have any success in getting people not to do that?
Oh, yes. Yes. Some are getting up and sleep eating. So
Oh, yeah.
another good problem.
Yeah.
But yes, because sleep is something that is so valued that a lot of times people will give up things that they wouldn't otherwise give up if they understand it's connected to their poor sleep. Because they can see, and when they learn what poor sleep does to their physical health and to their mental health, they're a little more motivated. So it's helping them understand, helping them know what it's worth. So, with alcohol, I'll just help them understand, it's fine if you drink. You just need at least 2 hours between every drink and bed. So if you have 2 drinks, it needs to be 4 hours before bed, or 3 drinks, it's 6 hours before bed. Well, that's like peeing in somebody's Wheaties. They don't love that, but at least I've explained how it works.
Yeah. Okay.
And I can explain them, how fast caffeine metabolizes and how that changes as we age. So there's just a lot of things about things people get addicted to.
Yeah.
Sometimes it's just TV. It's just TV. It's staying up late at night.
Yeah.
It's just habits.
I'll admit that I'm not the best. I concentrate on the snoring and the sleep apnea, and I'm not the best at if I see that they drink alcohol of any kind, saying, okay, when exactly do you drink this? So, and many of them, the vast majority of my patients have some kind of insomnia. But it's why I think that we really, and I've written articles on this, how collaboration with the medical industry and different healthcare practitioners is so important, because these diseases don't happen in a silo. They're all interconnected. So what role, let's just start with the psychologists like yourself, what role do psychologists have in looking for signs of sleep disordered breathing? What should the psychologists be looking for, and should they be finding a dentist that does this, or a sleep physician?
Absolutely. And not all psychologists know this. Right. I think, when you're looking for a professional to work with, you're either going to have to educate them, or you're going to have to find someone who is educated to understand this. But it's, for me, I'm going to refer someone, and I do quite often, if they if they are getting enough sleep, but they're still tired, if they aren't getting sleep, and I've ruled out some of the other causes, we've already gotten rid of their caffeine. We've already, made sure there's no alcohol. We're following good sleep hygiene. We're, right down the line, and we're still not sleeping well. Or if there's a bed partner, or they've been told that there's any form of snoring, if they have reflux. One woman was telling me she's having panic. She's waking up in panic, thinking it's a panic attack. And so I told her, are you sure that's not reflux? And, she wasn't sure. She just knows she's waking up in a panic. And I said, well, sometimes it's reflux and sometimes it's apnea. And people don't realize that. But when it happens, they can wake up in a jolt and in a panic. And so I've referred her for a sleep study. And it may be that it's a panic attack she's having in the middle of the night, but it may be that it's caused from apnea, which reflux is often caused by apnea. And it's a big clue to me that there's likely apnea there. A lot of people, they don't want to identify with the word snoring. So I think that's a thing you probably have to get around a lot.
Well, women purr.
That's right.
Men snore.
That's
so
right.
There's a difference.
That's right. And I think, when a woman says, I don't snore, and the husband says, yeah, you do.
Yes.
I think, you can help by either smiling and saying nothing, or by saying, well, if you're purring maybe on occasion, I think you can make it better.
Yeah, so along those lines, we do have couples that come in a lot. I don't do dentistry anymore, but I remember back when I did do dentistry, I never had couples in the room at the same time. It just didn't happen. But in this field, they're together a lot, and there's multiple reasons. But I think largely it's because that bed partner knows more about how that person sleeps. I had one today, and his for those of you that know, and most people watching this will know, his HI was 101, triple severe, and he didn't know it, but his wife sees it all the time.
Right.
However, sometimes they get into little conflagrations with each other. That's a big word, but I used it.
Yeah.
So they might not be agreeing in the room. So it can become a little bit tense.
Right.
And we're not taught psychology in dental school.
Usually in a setting like that, it's going to be kind of a playful jest.
Yeah, it's not. Yeah, I know what you
Usually
mean.
it's going to be a playful jest. So, there's probably some comeback that you could come up with that would be something like, well, maybe you were sleeping, something about one of them, just some, well, in the nighttime, we're not always sure what's happening. That's why we do these sleep studies, so something that just sort of is disarming, that doesn't take a side, but just pursues analysis.
Yeah, us dentists, we don't deal with conflict very well. So we want to kind of back up. And yeah, I worry about taking sides. That's exactly what my concern is sometimes.
Yeah.
And so I have to really think about what I'm going to say before I say it, because if I
And
say
you
the
don't
wrong
want
thing,
to take sides. You don't want to say, now, if she says you're snoring, you're probably snoring. You don't want to do that. But you can say, that's why we do these tests, because the tests really help us understand what's happening. And lots of times we don't realize what's happening to ourselves when we sleep. We just can't tell. So
okay.
we don't really
Well,
need opinions. We just need the test.
all right. So back to mental health professionals. And when I say that, is that a proper term, mental health professional, or
Fine.
does that include therapists, psychologists, psychiatrists? Does that include the whole gamut?
It does.
Okay. So how do we know by, we're talking to a patient and they come in for snoring, but they've got insomnia, they've got other health issues. What's the best kind of patient to talk to about needing to see somebody for their mental health? I mean, what should we be looking for? Is there a specific list of questions on our health history that would help us?
I think you definitely want to refer anyone where it's not making sense, where maybe they came to you, even did a test and didn't have very severe apnea, but they came to you. That means they need more help. If 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 they indicate any issues with anything on your, and I'm trying to think of what questions might make sense. Maybe stress. If you could have them rate their stress on a scale of 1 to 10, something
Ah,
like that, that would indicate, somebody that's under more stress, that would be, then you could say, I noticed you indicated a good amount of stress in your life. Have you ever considered talking to a mental health professional to help you with both your sleep and your stress? Something like that.
okay.
They're not going to report specifics, but they'll report stress.
Well, and I know, insomnia is the bane of our existence in this world. We know how to fix snoring. We know how to fix sleep apnea. Whether it's with an appliance or a PAP machine.
Yeah.
But then you fix their snoring, you fix their sleep apnea, and they still wake up 2 or 3 times in the middle of the night. They have especially sleep onset insomnia.
Yeah.
I've always perceived that might be the best kind of patient to send to a therapist if they've got sleep onset insomnia rather than
For
sleep
sure.
maintenance.
Although, even the sleep maintenance ones, you're going to find things. Sometimes it's going to be the medications they've been prescribed. Things like the way melatonin affects a lot of people. It might help them fall asleep, but it's going to make them wake up too early. And that's not the same for everyone, but for many people that happens. So if I've got somebody, I know they're taking melatonin, they're waking up too early, I'm going to think it's the melatonin, and I'm going to look for something else. I'm going to recommend some other things that aren't going to do that. And I've spent a lot of time investigating, amino acids and things from the health food store that can help us that don't leave you with all those side effects. If they're taking, any psychotropics, if they're taking sleep medicines, there's all the side effects, all the things they're going to have from any of those. So, when I send them to a doctor for any kind of medication, I encourage them not to get sleep medicine. Just beg them not to do that.
Yeah.
But when they come to me already on Ambien or already on Trazodone or already on something, then we have to work on that. And I've had people, have some real trouble getting off their sleep medicine. They're addicted to that sleep medicine, and it's tough. But we
Yeah.
can't fix their sleep till we get them off that sleep medicine.
I would say a healthy percentage of our patients are on some kind of sleep aid of
Mm-hmm.
whether it's and many times it's trazodone. It seems to be the most common, but they're taking a number of other things as well, and they've tried it. And most of them have already tried melatonin. And in fact, it seems like most of my patients say they've already cut out the caffeine. I think they're telling me the truth. I don't know why they
You
would lie
know,
about that
well, because they're
necessarily.
saying they cut out the caffeine right before bed.
Well, no, I do ask them. I say, when is the last time you have caffeine during the day? So a common problem that we have, sometimes our patients come in and they're already sleeping apart from their partner.
Yes.
And unfortunately, they've set up this comfortable environment in the other room. They have their own dog or the absence of a dog.
Right.
They
They're 15 pillows. They're
they can go to bed at the right time. They don't have the TV blaring when they're trying to go to sleep
yeah.
anymore. Right. So, but then we stop the snoring, we fix them, and they're so comfortable they don't get back together. Now I know I've read some research about couples that sleep together will actually live longer because
Yes.
of pheromone transfers and stuff. But
Yes.
um, can you think of any way that we could help people get back together? How could we somehow convince them? I don't have a good.
Yeah, well, it's a lot like COVID. People don't want to get back to the office. They don't want to leave their comfort. I'm seeing a ton of those people.
Yeah.
And I think, I think that's a good place for therapy and a good place for someone like myself to be able to talk to them about the value that comes from sleeping together and about giving that a try. And, when they complain about all the reasons they don't, then we can try to address those reasons.
Well, I don't know. I don't think any of us in dentistry want to be marriage and family therapists. I can tell you that. And I think I'm hoping. I mean, first of all, I really appreciate you chatting with us a little bit today. You're going to be at the Sleep Roundtable this year, our 10th annual. You're going to be on a panel with 2 other psychologists. It's going to be a lot of fun.
Great.
It's a very important topic that I hope everybody understands. It's vital that we understand more about this in our treatment of our patients that are coming in.
It is. It is for ours as well. Um, if we want them to get better, they need to sleep.
Yes, they do. All right. So for those of you that haven't registered, you can certainly hear a lot more from Dr. Austin and the other psychologists there. It is October 7th through 10th in Dallas, Texas. We're back this year after a forced COVID break in 2020. We tried to have our 10th annual in 2020. It didn't happen, but this year it should happen. It will happen. There will be hundreds of sleep dentists there with their teams all around the country. So come on out and join us. We're going to have a great meeting, and you can have an up and personal conversation with the inimitable Dr. Karla Austin. Thank you very much once again for being with us today.
Right.